So there are various reasons, and the answer to this is multifold. So one of the first reasons why we found COVID higher in children this time was because kids were obviously let out to play. If you see in the last lockdown, I don't think kids came in contact with other children, did not come in contact with other adults as much. So we found that just before this wave happened, a lot of us let our guard down. Our children were allowed to play with other children, go out into the apartments. And I think that high level of interaction which was happening, some schools and colleges opened as well. This high level of interaction did result in many of them coming in contact with the virus, which they didn't in the first wave. The second thing is we need to understand that this is a variant. So this variant virus, we are seeing that it could be a peculiar behavior of the virus itself, where it is beginning to affect children more than what it did in the first wave. So two reasons. One is the interaction of children has gone higher, as well as the fact that the virus itself is a variant virus. But what we need to understand is, yes, even though children are getting affected in high numbers in this wave, fortunately, many are doing well. We don't see a high amount of mortality in children, and many of them can be managed at home itself. So these are the reasons why the high numbers are there. But we are also worried that as this progresses, the pandemic, as adults start getting more and more vaccinated, children again can get affected as well. So which means that as we go into the third wave of the pandemic, which we should anticipate and we should be prepared for, more number of children can get affected in the third wave because more adults will start getting vaccinated. So even the current data, if you see, a large number of the positive cases are people who are below the age of 50. And a huge number, nearly 10 to 12%, are children below the age of 18 years, which means that as we start vaccinating the above 18 population, in the third wave, more and more children can get affected because they are going to be the vulnerable population.